mostly that bruising. You can tell what's going on.
If you buy them early, you can get them like $4 sometimes.
What's the difference between 18 and 30? Advanced purchase tickets? No. Fair.
Yeah. When you put advanced purchase, sometimes they're cheap. Like, but you have to wait like at least a week. Or something like that.
What about that web money thing?
Alright, so
That's what you buy today.
we just kind of talk about that.
No.
Hip flexor, again, know the anatomy, the iliopsoas group, comparing that to whether it's a rectus femoris strain. So if you do your manual muscle testing, which you'll learn about in evaluation class, if the athlete comes to you and they're saying they have pain in the quad, and if you test their muscle testing and you have them just extend their knee and they don't have any pain, what does that indicate?
Extend their knee.
They're extending their knee, and that's it. But they don't
There's
have
no
any
pain?
pain with that.
That's probably not their cause.
Yeah, but if they have pain with hip flexion, it'll be
Rectus.
their,
Rectus femoris.
it'll be
Or
more their
iliopsoas.
iliopsoas group.
Oh, okay.
Okay. But if they have pain with hip flexion resistance and knee extension, it'll be your quads, rectus femoris. Okay. Adductor groin strains. This is a very common preseason injury. This and see, your groins and your hip flexors both will be. You'll see a lot of athletes at the beginning of the season will be weaker, and that's just due to the fact that it's just not a strong muscle group, and those ligament or those tendons will be the first ones to go. So rehabbing your adductors. So if you're having a groin strain, again, like I said earlier, you want to focus on the surrounding muscles, not just that specific muscle. So you'll do your hip rotators, your adductors, abductors, quads, hamstrings, and whatnot. Also, a good thing for thigh injuries is to have a compression sleeve, kind of like those neoprene sleeves you can give. It'll cause some extra support for the muscle that's damaged. They can use that during weightlifting and any activity to practice. Okay, the quadriceps can, under there it says contractors with your Baja and Alta. You'll hear that referred to, that's referring to the patella. So patella baja is where the patella sits low on the knee, and then alta is where it sits high. And that can be due to quad tightness or lack of quad tightness. And then hip flexors, you'll see sometimes if you're having a patient, you're checking their hip flexors out and they're saying that they're having pain with it, and you see them you have them raise their leg straight up, you can tell whether they're activating their core by, if they're laying flat and they kind of arch their back, they're not activating their core, they're using just their hip flexors. So you'll need to work on core activation with that patient. Because basically they're putting all their stress on the hip flexors rather than their abdominals. Okay, and these are just some exercises for hamstring strengthening, quad strengthening, hip flexor, adductors strengthening. So for you to let your athlete go back and return to play, you need to...
You have an issue with the projector?
Yes.
You won't turn on at all.
Okay.
Like that, if you push the button over there, it won't switch over to on.
I think your bowl burned out.
Oh.
I need to climb the desk.
You can use mine.
sorry for interrupting your class. I
You're fine.
apologize.
Yeah, she's 10, keep on away, she's fine. They'll survive.
That was my.
Oh, I'm sorry.